Welcome to the second lecture of our pharmacodynamic series. In this lesson, we'll explore how a drug's effect changes with dose. This understanding allows us to predict how much drug to give, how it will behave, and what to expect from it. Why does dose response matters? The dose response relationship describes how drug effect varies with doses. It helps us define the minimum effective dose, maximum response, and how potent or effective a drug is. This is essential for safe and effective drug use. There are two types of dose response relationships. The graded dose response, which shows how the magnitude of the effect increases with dose. It is a continuous response, like lowering blood pressure in a patient with specific dose. And the second is the quantal dose response, which shows how many individuals in a population achieve a specific outcome at each dose, which means all or none response. For example, to see the seizure prevention in percentage of population. Graded dose response curve is a sigmoid curve showing dose on x-axis and response on y-axis, whereas quantal dose response curves plots the percentage of individuals who show a defined effect at various doses. The threshold dose is where the drug begins to show an effect. EC₅₀ is the dose that gives 50% of maximal response. This is potency. Emax is the maximum effect the drug can achieve. This is known as efficacy. Let us see what is drug potency and efficacy. Potency refers to the amount of drug required to produce a given effect. A more potent drug will require a smaller dose to achieve the same effect as the less potent one. Efficacy, on the other hand, refers to the maximal effect a drug can achieve, regardless of dose. It is the ceiling of the drug's action. On a dose response curve, potency is related to the position along the x-axis, the dose required, and efficacy is related to the height of the curve on the y-axis, the maximal response. Now, this dose response curve compares two drugs. Drug B requires a lower dose to start, showing an effect, so it's more potent. But drug A reaches a higher maximum effect, so it has greater efficacy. Clinically, efficacy is often more important than potency. As long as a drug is effective at a safe dose, how potent it is doesn't really matter. For example, take morphine and codeine. Morphine produces stronger analgesia. It's more efficacious. Codeine is less potent and also less efficacious. So, in severe pain, morphine is preferred. So, to summarize, potency is about how much drug is needed. Efficacy is about how much can be achieved. For treatment outcomes, efficacy is usually the determining factor. These help us define ED50. It is a dose for 50% effective response. TD50 is dose for 50% toxic response, while LD50 is the dose that is lethal in 50% of subjects in animal studies. Now we will see what therapeutic index means. Therapeutic index is a numerical value that expresses the safety margin of a drug. It is the ratio between the dose that causes toxicity in 50% of the population, that is TD50, and the dose that causes the desired effect in 50% of the population, that is ED50. A higher therapeutic index means the drug is relatively safe. Low TI means a narrow margin between the benefit and harm, requiring close monitoring. Some drugs have a narrow therapeutic index, such as digoxin, lithium, and warfarin. These require careful dose adjustment and monitoring due to small window between therapeutic and toxic effects. In contrast, drugs like penicillin or paracetamol, when used appropriately, have a wide therapeutic window, meaning they are much safer and less likely to cause toxicity. In summary, the therapeutic index is a critical measure of drug safety. Understanding it helps clinicians use drugs more effectively and avoid adverse outcomes. In practice, these principles guide dose titration, help us compare drugs, and allow us to avoid overdosing. They also explain why patients respond differently to the same drug due to genetics, disease state, or other medication. Now, let's see what is antagonism. Drug antagonism is when one substance interferes with or reduces the effect of another. This can happen at the receptor level or elsewhere in the body. Sometimes this is intentional, like antidotes, and other times it's side effect of the drug. Antagonism can be classified into four major types. First is receptor antagonism. It involves drugs acting at the same receptor. Then is physiological antagonism. It involves opposite action on different receptors. Chemical antagonism is a direct chemical interaction, while pharmacokinetic antagonism alters the absorption, distribution, or elimination of another drug. Let's understand how drugs can interact at their site of action. There are three main types of pharmacodynamic interactions. First, additive, synergistic, and antagonistic. These interactions may amplify or suppress the net therapeutic or toxic effects. An additive effect means the final outcome equals the sum of the individual drug effects. This often happens when drug acts via the same mechanism or pathway. For instance, aspirin and clopidogrel both inhibit platelet aggregation, so their combination increases the risk of bleeding. In synergistic reaction, the combined effect is greater than the expected from the individual drug. This is particularly useful in infections or cancer treatment. An example is cotrimazole, a combination of trimethorphan and sulfamethoxam, which blocks two steps in bacterial folate synthesis. Antagonism means one drug reduces or blocks the effect of another. This can happen by competing for the same receptor or interfering with the downstream signaling. For example, omeprazole protects the stomach lining from NSAIDs-induced ulcers, not by blocking NSAIDs, but by countering acid secretion. Thus, understanding pharmacodynamic interaction helps us enhance treatment strategies. For example, in combining anti-cancer drugs or antimicrobials. However, unintended additive effects can lead to toxicity, making monitoring essential. Thank you.